Hi, I'm Mark Milligan.
And I'm Melissa Cady.
And welcome to the Pain Chats autocomplete interview.
I'm an anesthesiologist and also a board-certified pain medicine physician, and I call myself the challenge doctor. You might see me online with various interviews of sorts or education. And Mark Milligan, what do you do?
I'm Mark Milligan. I'm a physical therapist in outpatient practice. I treat patients all across Austin and also teach other physical therapist education across the country as well. So we're happy to be here.
First question is, what is low back pain, Mark?
I have no idea what low back pain is. To
You
be
don't?
honest. Yeah, I know.
Is that why people look it
That's
up?
why I Google it, right? And this is
Oh.
an amazing tool that most people use. We call it Dr. Google in our circles, right? So when
Right.
people have to figure out something that they don't know anything about, they always search for it. So
What is low back pain? One of the most common searches when people have back pain, and this is the first thing that comes up. So what is it? Do you want to take a stab at it?
Well, it's probably pain perceived in the low back. Wouldn't that be?
yeah, I
what
would
it
agree.
is?
I would think that it's some kind of discomfort in the lower back area.
Right.
So
It's a symptom, though. It's not really telling you why.
right, exactly.
So let's look at this next question.
Oh yeah.
What
Ooh.
is chronic low back pain?
Yeah, so chronic low back pain, I think to the layperson or to people out there, chronic can have different meanings. One, it could mean that it's just aching, and it can actually have a descriptive value, not just a timeline value. To professionals, most people think that chronic just means that it's symptoms that have lasted a long time. But some people, they really think that it's something that has an antagonistic or a really negative value to them for that meaning.
Right, and they might actually think that it's like never going to get better, that there's no resolution ever. But sometimes, another word we like to use in the medical profession as we learn more about the pain science is that they think of it more as persistent, that it's just persisting for some reason.
Yeah,
Would
that's
you
a
agree
tough
with
one. Yeah, that's a tough one because people see chronic and they think it's debilitating. They associate that. So it's good to think that from our perspective, from a medical person perspective, it's more about chronic just means symptoms for a longer period of time, right? Acute is a short, the acute is the immediate, and then the chronic is the long term.
Right, and doesn't chronic or persistent pain, it has to be acute at some point. So a lot of people forget that it starts at a certain point, so it's new, but most people expect it to go away at some point.
Yeah.
And when it keeps going, it's chronic or persistent.
All right,
So let's do number 3.
All right,
Does that sound
tear
good?
it off.
All right.
Uh-oh, I'm scared.
What is mechanical low back pain?
Mechanical low back pain.
Well, you can look at it from a few different ways. I mean, if you're mechanically moving, it seems like your back hurts with mechanical changes.
Right.
What do you think?
Yeah, I think most people, both professional and just everybody out there experiencing back pain, this term really means pain with movement, right? That it has a mechanical kind of origin, right? If I move this way, it hurts this way. If I move this way, it hurts that way. So there's really a movement perception around mechanical low back pain.
Right, and it doesn't tell you why necessarily
it
you
doesn't.
have the pain.
And it also just sucks because it hurts every time you move too, right? So it's one of those challenging things. But mechanical just means there's a motion component to it. Yeah.
Right.
Yeah.
Well, let's look at the next one here. Let's see. Oh, this is a good one.
Ooh.
What is the best exercise for low back pain? I'll just take a stab at it. There is no perfect best exercise, and the one thing about people who are in pain, as anyone would experience that's looking things up on Google, that your experience is unique, it's personal, and there are so many different things that contribute to pain that you really have to explore all of those options and figure out what works best for you.
Right. Could not agree more. As someone who has chronic low back pain, that's mechanical in nature, I find that any exercise that I can do is the best one for me, right? The one that doesn't hurt, the one that allows me to be functional, like walking is a great one because you can't really do much lying on your back. So anything that gets me moving that helps alleviate or decrease my pain is the one that I choose for me. So working with your professionals and helping find those movements that allow you to move without that pain is really a key in the whole component. But really the best exercise for low back pain is the one that doesn't hurt.
Right.
Yeah, which is hard sometimes. Which
Which
is
is
very
tough
hard.
because
Yeah.
you're exploring it and you're tapping into that, like maybe that pain a little bit and figuring things out along the way.
Yeah.
But there is one bad thing is like doing nothing. There's some real catastrophic consequences
Right.
from doing nothing and not moving. Do
Right.
you want to tap into that?
Yeah, the old adage of going to bed for 3 or 4 days if you have back pain is arguably one of the worst things you can do for long-term prognosis. You really want to make sure that you get moving, and finding that motion and finding the way to move is really important, why you should work with other people to help get you there.
Yeah, I totally agree.
All
All
right.
right, let's take the stab at the next one here. Ooh, what is the cause of low back pain?
If I had that answer, I would be a bazillionaire.
Yes.
Yeah,
Yeah.
because that's one of those things where there's a lot of different layers here, right? So mechanical low back pain, or what low back pain, can happen to anyone at any time. Most people on this planet will experience low back pain of some type in their life. This is a very common occurrence and a very familiar theme. So back pain, it's such a complex question because there's really no true definitive cause of what back pain is.
Right.
And back pain can persist long after tissues heal. And so in the immediate phase, or that immediate phase of hurt, there's lots of physiological reasons, or lots of bony parts of pieces that can be injured. But in the chronic stage, or in the long-term stage, a lot of it is more within the nervous system in the brain that can cause those sensations and pain. So that's a tricky answer. What are your thoughts?
Right. Well, I think it's interesting that sometimes you may not necessarily have to have the true understanding of the real cause, but figuring out what helps make it better or worse. And it really takes somebody to understand all of the components that can contribute to a pain experience, which of course the nervous system is a fundamental, important piece that contributes to pain.
Yeah, of course.
So,
and also, on the cause of low back pain, like you said, Melissa, one of the things is you don't necessarily have to know the reason. And a lot of people that experience pain want to find an answer, and that's a tough thing. So they'll get images, and they'll get other kind of diagnostic tests that kind of try to show them where their pain is coming from. And most of the time that doesn't necessarily equate where their pain is coming from. So you get a lot of false information, or you can get false information from imaging and other studies that show you an issue that may not be the true pain generator. So
Right.
Even though we may not know the exact cause, that doesn't mean we don't know that we can get you better, or that there's ways that you can be better. We just have to know that there's a lot of things that are unexplained when it comes to the complexity of pain.
Right, and I like to remind people that sometimes, just looking at an image is kind of like me looking at your brain with a cool, complex, technologically advanced MRI. I can look at the brain, but it doesn't tell me what you're thinking. It doesn't tell me what you're experiencing. And the same thing is with the parts of the body that have been undergoing different stresses and adapting to your life. It doesn't really tell you or have a little flag that says there's pain here. So it can be very deceiving and very misguided sometimes. There's people that get these causes or diagnoses, and it doesn't mean that you're going to have to be married to that. It means you can still maybe get better even if you have that diagnosis or
Agreed.
Image finding.
Agreed.
All right, you want to
let's
hit
do
the last one?
Get the last one.
All right. What is non-specific low back pain? Our favorite.
Yeah, our favorite topic. I think I'm going to name my next dog non-specific.
I
low back
know.
pain.
It's pretty much just like a lot of things. There's a lot of terminology and names that are given to things, but we don't have a specific reason to say why you have the pain.
Yeah.
Basically means we don't really know why you have back pain. Going back to the first question, or a couple of these questions, or what is low back pain? The non-specific doesn't really help you. Maybe you went through ruling out what's called red flags, or these things that are concerning, and they're not there. And so now we're just trying to figure out what to do or what really is going on. What do you think?
So this term is really, it's an interesting term because they've done studies that they asked patients what they thought about non-specific low back pain, that exact term. And for people that are experiencing it, and then a provider calls it non-specific low back pain, that actually to the patients meant that the provider had no idea what was happening. Right? So for a lot of people, when you say non-specific low back pain, they think that you don't know what you're talking about. And while we, from a provider standpoint, when we say non-specific low back pain, means there's no exact cause that we can pin it on. There's no fracture, there's no obvious tumors, there's no obvious structural damage that's causing these symptoms. It's really a non-specific low back pain issue. So it's really, when it comes to education and communication, this can be a really challenging term on both ends, because we use the term out all the time, and patients don't understand what we think they understand it to mean.
Right.
So it can be a very challenging topic. So non-specific low back pain really means that there's no frank findings that are structural issues in your back, but more there's other tissues that may be causing that pain that we need to further flush out. So it's a tough thing a tough term to grasp.
Right, and
Yeah.
speaking of just education, if you really want to learn more about pain and persistent pain and all of these different things that we're speaking about, you can definitely learn more at the Pain Chats website and dive into a lot of the articles and blogs and give yourself a better perspective of pain.